can't join us today, so I think we'll go ahead and start the recording right now. So for those of you who are joining us on the recording, welcome. This is our second biannual check-in call for the Colorado Health Access Fund. I'm going to move on to the next slide here, which is our plan for the call. And we'll just do a couple introductions of some of us on the evaluation team and at the Denver Foundation, but I don't think we'll be able to go through introductions of everybody that is on the phone today because we do have 30 or 40 people that are joining us. I would like to go over some upcoming dates that are important to know. And then I want you to kind of be thinking about just how things are going. Maybe you're in the middle of your grant program, maybe you're at the beginning or at the end, and then you're also putting together your report. Many of you have a report that is due on September 30th, and so I wanted to use this as a chance to just kind of check in and see how things are going. Also, preparing for the Learning Circle in October. We'll talk a little bit more about that in a bit, but this is our annual gathering, convening of all of the grantees of the Colorado Health Access Fund, all of the current grantees, and we have some homework for you that we want you to kind of think about in advance. And then finally, last but not least, I've invited a couple of the grantees to talk about their experiences in terms of connecting evaluation to their accomplishments under the Colorado Health Access Fund. So I'm really looking forward to hearing directly from them. So with that, I will move along to just some quick introductions. So Alex and I have introduced ourselves. For those of you on the recording, I'm Jeff Bontrager. I'm the Director of Research on Coverage and Access here at the Colorado Health Institute, also serving as the Principal Investigator on the evaluation of the Colorado Health Access Fund. And Alex, do you want to introduce yourself?
Sure. So, hey everybody, I'm Alex Caldwell. I'm the Associate Director of Program Development and Analysis at CHI, and I work with Jeff on this evaluation. So I know lots of you guys.
And we are joined by Cindy Willard at the Denver Foundation, and I believe, Cindy, you are going to give kind of a welcome and some opening remarks. We unmuted you, so you are live.
Okay, great. Hi, everybody. This is Cindy Willard, and I am joined by many of you heard from both of us. We send our regards from Christy. She's out of the office today, and is sorry she couldn't be with us. Thank you all for making time to be with us today. We really value all of the great information you share with us through this evaluation. We're excited to hear your feedback today and how it's all going for you, and are interested in using this as a learning tool. So thank you for sharing all of that with us. Some of you may know and actually have been hugely helpful in us thinking through kind of what's going to happen to the fund for the next 4 years. So as you all know, the Health Access Fund is spending down all of its resources by 2022. And so we have taken a big part of this year with great help from the folks at the Colorado Health Institute to think about what kind of strategic refresh we might do. So are there opportunities that we could capitalize on in the next 4 years that we might add to our existing strategies? And we're excited that we're moving through that process, and this fall we'll be able to share with you our plans for the last 4 years of the fund. Please know that the RFP that we have done every year is absolutely going to continue, so we're going to keep doing funding that you all have received through the end of the life of the fund, but there may be a couple of things that we add to that. So we're excited to share that information with you later in the fall. So keep your ears open for that, and are really excited to see everyone in person next month at the Learning Circles. As you know, we pop in for lunch, and we make sure that you all are fed and have plenty of great things to keep you hydrated during that, and don't actually participate, but it's a great time for us to at least get to see all of you and to connect in person, as we really appreciate all of our relationships. So as always, feel free to reach out to us, but we're just going to sit back and listen on the call, but please know that we're here to learn with you, that anything you share today is certainly kept in that learning mind frame and helping us really understand your work in a deeper way. So thank you for being part of the call today.
Great. Thank you so much, Cindy and Steph, for joining us today. Moving on to the guiding principles for the evaluation, I think it's always important for us to keep these in mind as we continue on with all of these evaluation efforts. So as you are familiar with, we have identified 5 principles that guide our evaluation. Won't spend much time here, but just as a refresher. First of all is embodying a learning orientation, and the Denver Foundation through the Colorado Health Access Fund is really committed to ensuring that the evaluation activities are first and foremost useful for the grantees. Therefore, one of the purposes of the evaluation is really to ensure that learning is happening throughout. The maximizing evaluation usefulness, we want to develop an evaluation, and we want the evaluation for you all as those who are working on the front lines to be useful, not to just sit on a shelf and collect dust. So we also would like for the evaluation activities to continue to spur on mid-course corrections and real-time improvements in the programs that are funded by the Colorado Health Access Fund. The third one is the ownership of the evaluation. So again, this isn't just an exercise for the Denver Foundation staff or for the Colorado Health Institute. We really want this to be owned by the people who are going to be using it, including the grantees, you all, as well as the Colorado Health Access Fund Advisory Committee and the board of the Denver Foundation, and in a broader sense, even policymakers who are learning about some of the policy opportunities or barriers that we have discovered through the course of the fund. Sustainability is an important guiding principle in that the activities, even though, as Cindy mentioned, the fund is going to be winding down over the next 4 years, we're very committed to ensuring that what was started or continued under the Colorado Health Access Fund continues beyond that, whether it's through the learnings and the evaluation and the policy opportunities, or whether it's by sustaining the programs that have already been initiated through the fund. And then the final guiding principle is around informing policy, and I mentioned this one, that it's an important one. Sustainability and informing policy kind of go hand in hand, I think, whereas as part of our evaluation framework is actually to identify what are some of the policy or regulatory barriers that might be challenging for you in carrying out your program to improve behavioral health care for Coloradans who need it most? Or are there policy opportunities that your program has identified that could benefit other grantees within, or other similar types of organizations within the state? So we really are looking at informing policy as an important component of our evaluation framework. In terms of who's on the phone, it's always useful, I think, to just kind of to step back and give some perspective that we have. It's a really great accomplishment, I think, to see the diversity and the number of grantees that have participated in the Colorado Health Access Fund. The very first cohort was awarded in 2015, and then we had 3 cohorts that were awarded in 2016, another in 2017, and then coming soon will be a new cohort 6, which will be, it's coming in 2018, and they will be joining us for the Learning Circle in October. So these are grantees that are just awarded, and I believe the plan, as Cindy had mentioned, is to continue having a cohort each year until throughout the life of the fund. What this also means is that some of the grantees that have been with us from the very beginning are actually winding their programs, or not their programs, but winding their participation in the fund down. So they were awarded in 2015. They may have gotten a 3-year grant, which ends this year in 2018. So I know a number of you who are in that first cohort are here on the phone with us, and we're going to actually be hearing from one of the grantees who is in their final month, really, of the program on today's call a little bit later. In terms of next steps, wanted to just go over sooner rather than later some of the upcoming dates that we should look forward to. So in terms of that inaugural cohort, these are the report dates. As I mentioned, they are, for those of the inaugural cohort who had a 3-year grant, they are doing their last report that's due on September 30th of 2018. Those in cohorts 2 and 3 have already turned in their reports earlier this year, and so that's why we have, when the next report is due, it's actually not until next March or June of 2019. But then cohorts 4 and 5 their annual evaluation reports are due on September 30th of this year as well. So that's why I say I know a number of you are working on these reports. Another important date to keep in mind is Monday, October 22nd of this year. It's our 2018 Learning Circle. And this is our all-day convening. It happens on an annual basis. It happens here in Denver, and it'll be the same location for those of you who have joined us in the past at the COPIC offices. And this is an opportunity for us to get together face-to-face to really learn new evaluation techniques, as well as understand what we have already learned and taken from our respective evaluations. And all of the current grantees are expected to send at least one person to the Learning Circle. Those of you whose funds are ending here in September, September 30th of 2018, you do not need to attend the Learning Circle, as well as anybody in a subsequent cohort whose grant funding may be ending. But if you are a current grantee as of October 22nd, we do expect you to attend the Learning Circle. And we really try to make it fun and interactive and useful for you. And I have some homework for you today that for those of you who will be attending the Learning Circle. Go ahead,
I'm
Alex.
just going to quickly pause, Jeff, because there's one question coming in that other people might have, which is from Jeremiah. Thanks to Jeremiah for getting on the chat really early and asking all grantees whose grants are still active are expected to attend. That means you are allowed to send one attendee, and new attendees may send up to 2. And so people wanted to know, what does new mean? And I think what we mean by that is you haven't been to a Learning Circle in the past.
Yeah.
And so hopefully that helps, Jeremiah, that a new grantee means you haven't been to the Learning Circle in the past. If you have, we expect just one attendee. That's just to kind of keep the numbers under control and make this the most effective use of everybody's time. Okay, thanks, Jeremiah.
Yeah, and really the new attendees will really all be that cohort 6 that I just went through, who are in the process of the contracting, I believe, right now, and they're actually not on the phone call today, but they will be at the Learning Circle. And we're going to be holding a kickoff call with them in the next couple of weeks as well for this new cohort 6. So that's really what that new attendee means. I'm going to move to the next slide, which is our refresher on our evaluation report revision. I'm going to come back to the homework that you have for the Learning Circle. So you can move the slide for it. Great. Thank you. So for those of you who are completing your reports, you may have noticed, and if you've completed them in the past, I just wanted to do a quick refresher as to why we made some of the revisions that we did. It's basically to help us understand and illustrate a couple of those re-aim, the reach, effectiveness, adoption, implementation, maintenance, that acronym. It's to understand those a little bit better. So for example, this first one, in terms of the revisions that we made, are who and how many people is the fund reaching? So we made some revisions to ensure more consistency and provide some more guidance to understanding the populations that you are targeting, who's getting the services, and how the fund is addressing inequities in accessing behavioral health care. The second change that you may notice is how well people are adopting or buying into programs. So we know that it's a challenge to really introduce a new program and to create a partnership with, say, a local school or another organization. So we wanted to ask you how that's going and what lessons we can collectively learn from that. Third is in kind of this maintenance area, which is how will programs be sustained after the funds from the Colorado Health Access Fund end. And so this, of course, is one of the most challenging things that we have identified in CHI's evaluation reports, and that you all have identified in your reports too. And we understand that sustainability can mean many things to many different people. So it could mean paying for the program in the future. Another one is how well it maintains its community partnerships in the community or its relationships with patients. So we're really trying to expand what we're talking about in terms of maintenance and sustainability. And then finally, there are some revisions that reflect our goal of understanding the questions from the perspective of a fund-supported program, meaning the specific program that the Colorado Health Access Fund is supporting versus your whole organization's mission and scope of work that you do. So most programs are housed or run within a larger organization. For example, a primary care clinic hiring a behavioral health provider that's supported by the fund. But we were really trying to get a little bit more at that. And so all of this is to say we are really trying to establish additional context for your evaluations. And so hopefully for those of you who have completed a couple of these evaluation reports and you see the revisions that we have made, that they make sense, and feel free to get in touch with us if you have questions as you are completing your reports. And if you've already completed your report and you're an overachiever and have turned it in already, kudos to you. We really appreciate that as well. So thank you. So right now, I'm going to actually ask Alex. I was going to open it up and just ask how it is going for the grantees that are on the phone. I realize, though, that we may have a lot of talking over each other. So what I think I'm going to suggest is that if you would like to provide an update, I know it's kind of a general question, but if you would like to provide an update, just do that via the chat feature right now. And if it's just as quick as a thumbs up or maybe we're finding this really challenging, I'll turn it over to Alex in a bit to see if there are any comments that are coming in. But we really do want to use this check-in webinar as a way to check in with you and see how it's going, and not only with your report, but with your program overall. And especially if you think there would be a question or feedback that are useful to other grantees.
Thanks, Jeff. In fact, we actually have one question coming in already that I bet lots of people have, and it's a really good one. It's from Anne. In the grant report, she's asking, when we have questions about the program, do we want to have answers in the evaluation report that are specific to the program funded by the grant dollars or the organization as a whole? And that's really important and a good question, Anne. What we're looking for is the answers specific to the program funded by the Colorado Health Access Fund. So that's a really good point, and sometimes that's hard to do. We understand money is fungible, but we want you to do your best to try to devote the evaluation results, attribute those to the dollars that are coming in from the fund, so that when we say, this is what the fund did, we're able to do that with confidence. So we need your help doing that. I hope that helps, Anne, but please let me know if that doesn't clarify. Great, thank you, Anne. We also have another comment coming in from Margot. Hey, Margot, from Inner City, saying good buy-in with four new medical staff. So that's exciting, and I bet other people probably have similar experiences getting the buy-in question is always a tough one if you're doing like integration and stuff like that. So maybe other people have similar experiences to Margot, or maybe different.
I'm pleased to hear that there's good buy-in. So yeah, thank you, Margot. If you have, are there others that came in?
Not yet, but I'm sure people are typing, and so please go ahead and continue to do that. For example, we got Tanya Cook saying it's been hit or miss when it comes to buy-in at remote sites from across the Western Slope. So when you're thinking about trying to get everybody to buy into a particular program across multiple sites, sounds like that's been a challenge for these guys. Christian says the evaluation itself is going well, but the challenge is always around Medicaid provider designation and transition to the race. So I think he's not alone in that.
Yeah, and so that's a big development that has happened since we last checked in together, which is that phase 2 of our state Medicaid programs, a big initiative called the Accountable Care Collaborative, has launched in July, which I know many of you are probably figuring out how now to work with your regional accountable entity. The RICOs the Regional Care Collaborative Organizations are no more, as well as the behavioral health organizations are no more. And so I suspect that many of you are working with your regional accountable entities. And I actually was going to ask for some feedback from you all. You can do it on the call or maybe afterwards. At the last Learning Circle, for those of you who are attending the Learning Circle in October, we did kind of an introduction to the Accountable Care Collaborative phase 2. And I know many of you were in the weeds on it. Some of you were more on the periphery of it. Now that it's fully launched, I wanted to maybe get some feedback from you as to whether that would be useful to have maybe a guest speaker from HCPUP or from the RAISE to come and talk to the grantees about some of the pressing issues, since we know many of you do deal with Medicaid. So you don't have to, we won't go through all of the responses, but if you have ideas you want to share, feel free to do that on the chat feature. And Alex, I'm going to actually ask you to go back a slide because I wanted to segue to preparing for the October 22nd Learning Circle. So a couple things that I'd like for those of you who are going to be attending that meeting in Denver to be thinking about. The first one is that be thinking about some examples of metrics or things that you measure within your organization to say, okay, this is how we measure success. And I'd like us to kind of have a forum at the Learning Circle where we discuss those. The second thing is we also understand the importance of stories of how the Colorado Health Access Fund has impacted an individual or family in your community. And we ask you to share those in your report, but sometimes I feel like we haven't dedicated enough time to really hearing those stories from each other. So I'd like for you to be thinking about what are some of the stories that you could share with others without breaching confidentiality, of course, of your clients, and bring those to the Learning Circle. And then the third thing is to think about how you would measure success and communicate the impact of the overall Colorado Health Access Fund. So being true to our nature at the Colorado Health Institute as being a learning organization, we would like to actually hear from you about what your ideas are about how to evaluate, in what ways should we evaluate the success of the fund. And this is a concept in evaluation that I've really been learning more about, which is to really involve the people who